Let's move to this now. It's been reported that hundreds of elderly persons could be left without essential care following the decision by the Department of Social Development in the Eastern Cape to make some cuts to its budget. This decision has hit NPOs providing social care services hard. Let's look at the impact of this and more with Noluntu Mlakalaka of the Imbumba Association for the Aged. Good evening to you, and thank you so much for your time. Give us a practical sense of what these funds exactly do.
These funds are meant for the older persons, for them to be cared for in the service centers during the day, starting from the nutrition, the nursing care, the recreation, and the administration.
And I wonder, how did you receive, because you're one of the NPOs that's been affected, I wonder how you received the news of these budget cuts and the practical impact it has had on your work?
We received the news after the beginning of the financial year, and we're not happy about the decision taken by the department, because the number that we are funded for is more than the number that they are willing to pay. They only pay for 20 beneficiaries instead of the number of beneficiaries that you have in the centers.
So if they're paying for 20 beneficiaries, how many people are covered by Imbumba?
We've got 55 centers. Each center has got its number. Some starting from 30, but the bigger center has got 245 beneficiaries. So he had to cut 225 beneficiaries.
And for someone watching tonight and they're saying, okay, these are social services that can be provided for easily, and some of them may not necessarily need money, I'd like us to give them a sense of what exactly the budget that you receive do, and on a practical level for these over 220 beneficiaries that you say are also in one center.
They are in one center. Can you come again?
Mam Noluntu, were you able to hear me? I was saying that for someone who's watching tonight and they're wondering what these social, budget cuts have done at a practical level, because you're saying to us one center has over 200 beneficiaries, and there's also now an apportionment of about 20 beneficiaries. Now, someone who's wondering tonight, what exactly does this money do for the beneficiaries?
We provide nutrition for them during the day when they are in the centers. We also buy cosmetics for them, like nappies for those who are bedridden, those who stay at home who are no longer coming to the centers. We also do the recreation for them. We also do the administration.
And we are in a time where the elderly persons are also, the most vulnerable as well. We've also seen some disturbing statistics when it comes to gender-based violence cases, and also neglect, cases of neglect as well. Just how vulnerable are they if they're not going to be part of the system that you are also running?
Yes, they are feeling bad because they knew that the centers do take the care for them. Our caregivers visit them almost every day at home. What we actually do is the home-based care. We care for them whilst they are at home. Even during the time of this COVID, we did visit them at home and help them with the medication, with everything, also to fetch their treatment at the clinics. So we can't do that service anymore because there's no money. We also take them with our own transports to the clinics when it's necessary. But now that the budget is cut, we can't do that anymore.
Mam Noluntu, what are they saying? What reasons are they giving for Lamakats?
But into babakhathe is because of COVID, so they had to cut the budget for centers, the service centers. And mind you, they are only funding these centers for only 200 rand per beneficiary since 2006. They never increased the tariffs since 2006.
So
Yes.
does it look like there'll be a solution between yourselves and the department at some point?
No, there's no solution up until now. There was a mediation because they asked for the mediation on the 14th of December, but the mediation was a failure. It failed dismal.
So what does this mean then for your work in the meantime?
For us to work in the meantime, we are using the available resources, but because we can't just leave the elderly like that. So we're making plans, which is not easy for us to make, because without the subsidy, there's nothing that we can do.
All right. Sorry about that situation, Mam Noluntu. It sounds like really a tall order, as you say that you're now having to dig deep into your own pockets, really to try and assist some of those that you are saying form part of the home-based care that you are giving to some of the communities. That was Mam Noluntu Mlakalaka. She's the spokesperson for the Imbumba Association for the Aged.